Hi, this is Ellie Ladensack. Today I'm going to be taking you through my brochure for ice gel packs. Specifically, this is for a patient who is 21 years old, a female volleyball player who presents to the clinic with an acute right knee patellar tendonitis. And this is actually me in college, so I thought it was very relevant to talk about my own experiences and how this treatment I used to do after practice every day, and I really found a lot of benefits in that. So I would explain this to the patient is I would have this pamphlet and I would say, okay, so up at the top here I have what the treatment is, which is ice, specifically using a gel pack. And then under that I have a reminder that the ice is most beneficial when combined with rest, ice, compression, and elevation. When those are all combined together, that's the RICE treatment, and so I have that up here just as a reminder. Under that I have benefits and risks, so I specifically go into the benefits and risks of cold and of the gel pack. And so to read out this, for cold, the biggest thing is decreasing swelling and pain, and the risks with that is wheals, which is, I actually put the picture on here of what that looks like just for their reference, and then I wrote a little disclaimer under that saying if you have this adverse reaction, it should dissipate in a day or so, and then no longer use ice as a treatment. And then for benefits and risks of the gel pack specifically, gel packs are inexpensive. You can find them on Amazon. They're easily available. They cover large surface areas and they mold to those joints very nicely, and they're reusable. And then the risks for those is you need to be using a towel between the gel pack and your skin because it is a different substance. It's not water in that pack. It's harder to regulate that temperature, so using that barrier is very, very important. Then I have under that is when to use this. And so under that I have after increased physical activity, especially if there is increased warmth or swelling of that joint, you should be using this treatment. And then if pain increases, this is a really great treatment to reduce pain. And then under that I go into the steps of using the application of ice. So first you should really gather all the materials. So the gel pack, the towel, ACE wrap because we are combining it with compression, which I will demonstrate, and pillows to elevate that leg. Second you're going to place the towel around that gel pack, and then you are going to put the gel pack over, in this case, the knee, and you're going to use that ACE wrap to tightly wrap around the knee. Now when you do this, it's very important that we don't get any discoloration below, so in the foot or lower leg, we don't want any discoloration or pain down there. So you want to make sure that yes, it should be tight, but it should be comfortable. You shouldn't be in pain from the tightness. Then after you do that, you're going to go ahead and lift your leg on top of some pillows is usually easiest, so you could either do this in bed or if you're laying flat on the couch, you can put some pillows and elevate that leg up to get a nice flow. And why we're doing this is so the blood flow is going back to the heart. So we always say keep that leg elevated above the level of the heart. And then I have down here under 6, you're gonna stay in this position for about 20 minutes, and then we don't really want to go over that because then you're more at risk for having an adverse reaction. So 20 minutes is a really good number to stay at. And then after that, you can remove the wrap and place the gel pack back in the freezer. All right, thanks. Okay, now that I've explained my brochure, now I'm gonna take you through all the steps on myself. So first step was to gather all your material. So you can see I have a stack of pillows here. I have an ACE wrap, just like the photo in the brochure. I have a ice pack here, and I have a towel. And this is just a normal hand towel that you could use in the bathroom. So first thing you want to do is cover your ice pack, like so. So you don't want to put this side on the skin, you want to put this side on the skin. Then what I'm going to do, I'm going to lift my leg up so you can see me a little bit better. You're going to place this over your knee, like so. And then you're gonna take your ACE wrap. Now this one is a Velcro ACE wrap. I also have one here, and this guy has little metal spiky things here. And you can use either one for this. This one's just a little longer and easier to use in this instance. So what I'm gonna do is I'm going to start at the bottom and work my way up. I like to do it this way because we are trying to get blood flow to go from distal to proximal, which means from your feet or your hands back up to your heart, which also is going to help when we elevate. So I'm just wrapping around here, working my way up. Now remember, when we're wrapping here, we want it tight, so we do want some compression to happen, but we should not get any pain, or if you notice in your toes that they're turning blue or they look like they're not getting any blood flow, we don't want that. We just want it tight enough to get the benefits of compression. So I'm wrapping all the way up. And I got the Velcro here, and this guy just Velcro's on. So then you're gonna wanna put that leg up above the level of the heart. So when I lay down, my heart is gonna be lower than this knee, but just for the sake of you seeing the whole thing, this is what the setup should look like. And for this particular patient, they should really be doing this after every single practice. They could be doing it just whenever they're getting pain in general, and yeah, this should very much help this patient. So let me know if you have any questions, and have a good day.